Hello everyone, a very good day to all of you. In the previous videos we have discussed about the H. pylori and its relation to mental health and psychological health. H. pylori, its relation to the digestive health and the treatments. Now the question people asking, how do we know that we have the H. pylori? It's actually by two ways. Either from the symptoms that we have mentioned. If you didn't see the video, go and see the video that we discussed about the symptoms of the H. pylori related to the digestive and outside the digestive system. Or you can do some diagnostic tools. You go to do investigations. How? We start from the easy to more complicated one. The very famous easy one is, we call it urea breath test, which is a blood test. You will go to the lab. They will ask you to drink certain fluid or capsule, contains the urea C13. Then later on, they will ask you to blow in a bag to check the CO2 level. And from there, they will tell you fast result whether you have H. pylori or not. This is first. Second, they will take a sample, blood sample, and they will do some investigation to check the antigen antibody things in the blood. Third tool of investigation, they will take a sample from your stool and they will check the H. pylori and the antigens related to that. Another way, which is more complicated, but they don't do it purposely for the H. pylori diagnosis, but they will do it for another reason. And by the way, they will take a sample for H. pylori, which is endoscopy. Yes, you will do that with the clinics and the specialists, usually the GIT specialists, they will do that. They will insert a tube with a camera. We call it the endoscopy. They will go inside and they will check the stomach, how it looks like. Is there any inflammation? Is there any redness? Is there any ulcer? And they will take a sample. This sample, they will test it for H. pylori, whether it's positive or negative. So these are the tools of diagnosis of H. pylori, from the easiest one to the more complicated one. Whatever you like, please don't ignore it. Don't simply keep taking over-the-counter medication to ease your heartburn. You take the antacids, or you will take the proton pump inhibitors by yourself, or you hear from someone else. Go and do some investigation. Don't ignore the symptoms that is related to the digestive and related to the H. pylori, because it can lead to gastritis, peptic ulcer, and the stomach cancer. We don't want you to get into that level of the stomach cancer. Please stay safe and healthy, and thank you so much.